Hi, my name is Ed Paget. I'm president of the Alberta Association of Osteopathic Manual Therapists. And I want to just take 5 minutes to help you choose your osteopathy school in Canada. Before I talk about schools, I just want to give you a quick rundown on the history of osteopathy. Osteopathy was established in the States around the 1880s by an American doctor called Andrew Taylor Still. In America, it is now a medical degree. You have to go to an osteopathic medical school and you will be awarded with a Doctor of Osteopathy. Doctors of Osteopathy and medical doctors are considered one and the same thing in America. You cannot tell the difference between a Doctor of Osteopathy and an MD if you stood them next to each other. In Europe, osteopathy became a manual healthcare qualification. So in UK, Europe, Australia and New Zealand, the osteopaths use their hands, or manual osteopathy, and it's very similar to physiotherapy or chiropractic. In Canada, osteopathy is considered a medical degree in 3 provinces, in British Columbia, in Alberta and Ontario. So in those provinces, the word osteopath is used exclusively for graduates of American osteopathic medical schools. So you cannot call yourself an osteopath in those provinces. Now I work in Alberta where I cannot call myself an osteopath, so I refer to myself as an osteopathic manual therapist. It's important to get the terminology right, because the College of Physicians and Surgeons would assume that you are practicing medicine without a license if you refer to yourself as an osteopath when you're not trained in an American College of Osteopathic Medicine. Now there are no exams regulating osteopathy in Canada. You don't have to come in from a board and take entrance exams to be able to call yourself an osteopath. In fact, no one is regulating manual osteopathy at all, which means that anyone can set up a school and anyone can call themselves an osteopath. So in order to not cause too much confusion in the public's mind, each province has an association. Some of those associations have joined together and are now members of a Canadian-wide federation. So the association that I'm president of, the AAOMT, is in turn a member of the Canadian Federation of Osteopathy. The Canadian Federation of Osteopathy joins many national bodies in being a member of the Osteopathic International Alliance. The Osteopathic International Alliance represents both American-trained doctors of osteopathy and European-trained manual osteopaths. So in Canada we have this interesting situation where there are both streams of osteopathy. In Quebec there is no title protection, therefore anyone can call themselves an osteopath. Osteopathy started in Quebec about 25 years ago from a European trained perspective, manual osteopathy. Now it's becoming confusing. There are many schools, many different associations. So Quebec is actually putting together some guidelines for minimal education, and it should become regulated in that province soon. What they're looking at is around 6,000 hours of a full-time course to be the correct requirements to become an osteopath in Quebec. What happens in Quebec will slowly trickle down through the other provinces, and most provinces will be accepting around a 6,000 hour course. At the moment, my association, the AOMT, accepts for a full-time course the WHO benchmarks, which are 4,200 hours of full-time osteopathic education. There are some part-time colleges as well that roughly meet that standard over about 6 years, a 6-year stretch. The WHO benchmarks talk about part-time colleges. They refer to this as type 2 education, and they're very vague on what that actually entails. One of the reasons they're vague is that in different countries, medical doctors can become osteopaths in a very shortened time frame. They don't need education in anatomy, physiology, pathology, or clinical skills. So that takes at least 3 years off a full-time course. So they can probably become osteopaths in about 1 year to 2 years. In Canada, some schools are teaching people who have a prior education in some sort of healthcare, like massage or reflexology, to be osteopaths in under 1 year. The AOMT feels as though that time frame just isn't quite long enough when you look internationally at the other levels. So we're looking for people to be educated to at least the same education as a full-time course, 4,200 hours by the WHO benchmarks. And in time, we will probably change that entry requirement to meet 6,000 hours to be in line with Quebec. In some provinces, there are more than one association. And why is that? Well, a school sets up their own educational sort of system, and then when they graduate, they realize that they can't join the main association. So what they do is they set up their own association. So look carefully at the different associations in your province and look at the membership. If the members all graduated from the same college, it's probably an alumni association or alumni membership just for the graduates of that school. And that is not representative of osteopathy in your province as a whole. For example, in Alberta, my province, we have people from Germany, from France, from England, from Canada. We have lots of different people from different qualifications, but they all meet the WHO benchmark guidelines. So choosing a school, the questions to ask are this. Will your qualification stack up to the minimum criteria of education that's happening in Quebec? If not, in a few years' time, you may find that you have to retake or upgrade your skills because they don't meet the 6,000 hours. The second question is, will your qualification meet international standards? Osteopathy internationally has a good reputation, and it's held out at least the same level as physiotherapy or chiropractic. If you're taking a course that is less than a year, ask yourself this: would you like to see a chiropractor that did a 6-month course in chiropractic and let him adjust your neck? Probably not. The same goes for osteopathy. Would you be happy seeing an osteopath who has just done an online course and has the minimal contact time with their teaching staff? Personally, I don't think so. I would be comfortable seeing someone that at least has a master's degree or even a bachelor's degree and has 4 years full-time education. That would make me feel comfortable. Well, I hope this has been informative and makes you look at schools with a little bit more of a critical eye to find out, are you going to get the best education for your money within Canada? Good luck.